Hello, dear friends. This is Sofya Dorinskaya with you, psychiatrist and head of the Sofya Dorinskaya Center for Medical Information. Today, I want to talk to you based directly on your comments about the so-called side effects of nicotinic acid. So let's discuss them together one by one, those side effects that you have read about and written to me about. So you write to me that nicotinic acid should not be used in cases of stomach ulcers. I want to emphasize once again that I am not treating anyone with my videos. If you are ill, if you have a disease such as a stomach ulcer, especially during an exacerbation, your treatment should be managed by your doctor, not by my videos. And of course, you can absolutely discuss the possibility of being prescribed nicotinic acid with your doctor. Because niacin, vitamin PP, or vitamin B3 are key to regulating the gastrointestinal tract, and its hypo and avitaminosis can lead to ulcers, to inflammation of the gastrointestinal tract, and so on, to diarrhea, and so on, to constipation. Here, what you always need to remember is that niacin is available in different forms. And if the doctor believes that during the acute phase you really need to administer niacin, then please, intramuscular injection is always, no one has cancelled it, right? But please cooperate with your doctors. If you are in the remission stage, yes, indeed, niacin increases the acidity of gastric juice. But here you need to understand that vitamins are food, they are nutrition, and should never be taken on an empty stomach or when you ate 2 hours ago. And you can always reduce the dose of this niacin, even to 1/4 of a tablet, taking it with food. In this way, your body will gradually start receiving its niacin, and over time it will resolve hypo and avitaminosis. That is, common sense is quite a good helper when you are trying to improve your condition. Next, redness. Even though I personally maintain an incredibly extensive library filled with research on vitamins, some medical doctors still frequently claim in their formal statements and professional presentations that the skin redness people experience is actually a direct allergy to niacin, rather than just a common and expected side effect of taking the supplement. But in reality, these claims do not stand up to any criticism at all. What kind of allergy is it that goes away in 30 to 40 minutes? What kind of allergic reaction is it that goes away with continued intake of the allergen, if you can call it that? Because if you keep taking the same dose of niacin, after a while the redness disappears. Well, what kind of allergy is that? In reality, the redness, that is the hyperemia caused by niacin, if you've ever experienced it yourself or observed it, is actually quite interesting. The redness usually appears along the edge of a swimsuit. That is, the areas of exposed skin that were under direct sunlight turn red. But the areas shaped like a t-shirt or say a swimsuit remain white. So your swimsuit or say your shorts and tank top literally appear on your body. What kind of selective allergic reaction is that? If you've ever had any X-ray exposure, you might get a square on your body from the screen used during a fluorography scan. If for some reason you were exposed to radiation, the side of your body that received the exposure will become very red and hyperemic. And if you had some kind of screen shielding you, then exactly where the screen protected your body, there won't be any redness. This leads us to the completely logical conclusion that nicotinic acid helps to cope with the effects of radiation, radioactive exposure. Nicotinic acid is destroyed by sunlight, and this is exactly what explains this kind of redness. Again, this is generally not an allergic reaction at all, because in the presence of an allergen, an allergic reaction never goes away. Here, if you continue taking the same dose of nicotinic acid, the redness subsides. I can say that this phenomenon is very beneficial. And so, for example, people who, due to their work, undergo annual preventive checkups with chest x-rays, for instance, which are mandatory I would recommend that you, for a certain period of time, perhaps a month or a month and a half, take 50 milligrams of nicotinic acid in order to, so to speak, eliminate or address the consequences of radioactive exposure that you are forced to undergo every year. If you are traveling to a sunny country, you should know that nicotinic acid is destroyed by sunlight, as I have already mentioned. So either during your stay or afterwards, take a course of nicotinic acid. This will also help you cope with the effects of sun exposure, which, well, I don't need to explain to you. Skin cancer and so on are precisely the consequences of a deficiency of nicotinic acid, which the body develops after serious sunbathing. Again, let me repeat, sunlight destroys nicotinic acid. So, this redness is a natural reaction of the body to nicotinic acid, precisely because most likely, and I think this conclusion is absolutely logical, it helps to mitigate the effects of radiation or radioactive exposure to the body. By the way, for those people who serve on submarines, instead of consuming alcohol, I think that if their doctors include nicotinic acid in their diet, it would be much more beneficial. And next, the following statements are about how nicotinic acid supposedly has a harmful effect on the liver. And indeed, I have seen these claims even in the package insert for nicotinic acid. But unfortunately, now, in 2018, these statements are akin to, well, it's like hearing a bell ring but not knowing where it is. What dose of nicotinic acid? For how long? Why does it really cause this liver damage? But honestly, the only reference to this data is, again, from the same author, Rice. Vitamins, where he notes that the author Cherkis, I have Cherkis's publications, but unfortunately they're from the early 20th century, 1929, but unfortunately I can't show the textbook right now, it's on the shelf, I didn't take it, that's that. I didn't find that reference there, but nevertheless, let's see what Rice writes. A single therapeutic dose of nicotinic acid ranges from 25 to 100 milligrams. The daily dose is usually 100 to 200 milligrams, but sometimes, depending on the indications, it can be increased to 600 milligrams. Page 121. Here is the publication, a large publication by Rice. Vitamins. Next. One should not overlook Cherkes's remarks that nicotinic acid, when administered in large doses, binds methyl groups and accelerates their excretion in the urine. Ladies and gentlemen, large doses mean more than 600 milligrams and above. When we talk about a dose of 50 or 100 milligrams, there's really nothing to discuss here. So these are Cherkes's remarks. Therefore, when prescribing large doses of nicotinic acid, and in fact in the further prescription of large doses, it should also be prolonged, not just a single use. That is, you have to keep taking and taking and taking and taking this nicotinic acid. Therefore, when prescribing large doses of nicotinic acid, notice what is the solution to this problem. First of all, it is necessary to include a sufficient amount of complete proteins in the diet. My warmest regards to those who are starving, which contain a lot of methionine, for example, cottage cheese. Therefore, my friends, if you don't behave according to the saying, make a fool pray to God and he'll smash his forehead, but instead approach the situation with common sense, then nicotinic acid in doses of 50, 100 milligrams, or as they write to us, up to 200 milligrams, up to 600 milligrams. As long as you eat normally, you are not starving, you eat meat, cottage cheese, chicken, red fish, caviar, you really do eat. Nicotinic acid is an absolutely normal substance that only brings one big undeniable benefit to your body. Of course, when you suffer from certain vascular disorders, it's true that nicotinic acid dilates. Well, it dilates the blood vessels and it can lower blood pressure. So, discuss this issue with your doctor. You see, the thing is, the theory of hypo and avitaminosis nowadays, from what I see in the reports our clients send us, and we have a huge number of people in general, the theory of hypo and avitaminosis has been thrown out in modern medicine. Doctors are not aware of it. But hypo and avitaminosis are the very foundation, the base, on which various pathological conditions later develop. Hypo and avitaminosis can last for years without symptoms. And right now I am preparing quite serious materials for publication on this topic. And you will all be able to buy these books and read them. These are books that have essentially been lost to medicine. I don't even think they exist anywhere in libraries. So hypo and avitaminosis can last for years. And of course, when a person already has long-standing severe hypo and avitaminosis and you start taking some vitamins, you begin to feel, well, a kind of movement, right? The body starts to come alive. That's why, of course, in all cases, a doctor's perspective is needed and caution is necessary. And if you have any serious illnesses, well, and from your side, common sense hasn't been cancelled either. Please don't eat things by the kilogram. Don't forget that salt is a substance without which the human body will die. But if you eat 250 grams at once, you'll die too. Sorry, but that can be called overeating. In Japan, for example, there is a rice cake festival where people die from overeating and then, well, they publish lists of the deceased. Well, I guess it's some kind of national pastime. So you shouldn't do that. You shouldn't do that. Common sense is, in general, the key to a long, happy, and healthy life. So, for those who didn't know where this idea comes from, that nicotinic acid destroys or rather leads to fatty liver disease, well, here you go, I'm telling you. I'm talking about doses from 600 milligrams and above for a long time. First, and second, you're not eating anything because it's honestly laughable to think that you just need to add cottage cheese to your diet. What? Is there anyone who doesn't eat cottage cheese? Well, if you're not eating normal foods that that allow the human body to function, then you'll have major problems anyway. Fatty liver, hepatosis. And if, due to hypo and vitaminosis, you start experiencing depression, stress, panic attacks, and begin taking antidepressants or tranquilizers, then please read about their side effects and compare the dangers of these substances with the supposed dangers of normal foods that a person should eat in order to live a healthy and happy life. I hope I have answered your comments, and I sincerely hope that I will no longer receive comments accusing me of hiding some terrible side effects of nicotinic acid from anyone. And again, stay on good terms with your doctors. One small nuance: no technology can replace a doctor's mind. And treat your doctors with care, respect your doctors, and communicate with them as your helpers, people who truly strive to help you. The vast majority of doctors are exactly like that, and this approach will really help you understand your condition and your pathology. You will find great friends in your doctors. This was Sofya Dorinskaya with you. Stay healthy. All the best. Goodbye.